So hello all and welcome to today's discussion. So the University of Cape Town's pesticide discussion forum. As I said, please do continue to introduce yourselves. I appreciate that. I am Professor Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in South Africa. Today's session is going to be on child labor and pesticide exposure, setting, enforcing, and monitoring regulations for a vulnerable population. And I am very fortunate to be able to introduce you shortly to my two esteemed colleagues from the US. But before I do, I would like to just remind everyone that this pesticide discussion forum is supported by the Swedish government through the Swedish Chemical Agency. In the background will be Tatum and Naomi doing technical support. If you need any help, there is a WhatsApp group. We encourage you to please go to the group for assistance. And a reminder, if you're just joining us, to please continue introducing yourselves in the chat room. So if you haven't joined the pesticide discussion before, just to let you know that really the purpose of this is to bring together representatives from different regions, different sectors, and different stakeholder groups, so that we can mutually support each other to discuss various issues related to pesticides. And as I said today, we're very fortunate to be talking about an unfortunate topic, which is child labor and pesticides. And particularly our pesticide discussion forum is focusing on building the capacity of regulators, particularly regulators in low and middle income countries, researchers, and NGOs. And we look at ways to discuss together through peer-to-peer learning, through sharing information. And today you'll be asked lots of questions and hopefully you'll share experiences from your own country. And we're hoping that we can fill gaps that way and problem solve together in order to prevent pesticide poisonings and environmental contamination with a view to a toxic-free future for the next generation. So do continue to introduce yourselves. I can see many of you are doing so, and you are most welcome. And I will now introduce our two speakers for today, who I have appreciated have taken the time to put together an important discussion for us. So we have Dr. Sarah Quant and Dr. Thomas Arcuri. So Dr. Sarah Quant is a US-based anthropologist and professor of epidemiology and prevention at Wake Forest School of Medicine in Winston-Salem, North Carolina in the US. And she holds a visiting faculty appointment at the University of Cape Town. She's studied occupational health and safety for Latino workers in the US since 1996, particularly focusing on agriculture and related pesticide exposures. Her research has also focused on behavioral aspects of pesticide exposure and ways to communicate risks to farm worker families with children. Sarah, you're most welcome, and thank you. And then we will also have Dr. Thomas Arcuri speaking to us today, who is also a US-based anthropologist and public health scientist, who is a professor of family and community medicine at Wake Forest School of Medicine. He also holds a visiting faculty appointment at the University of Cape Town. And since 1992, he has conducted a program of community-based participatory research and intervention to improve the occupational health and safety of agricultural workers, particularly pesticide safety among Latinx workers. Tom, you are most welcome, and thank you to both of you for your time. So Sarah, I believe I'm going to hand over to you to start the introduction, and then I think Tom will take us through to question one. So Sarah, over to you, and thank you.
Thank you, Andrea. We're both very glad to be here today to talk about child labor and pesticides. Just by way of introduction, I want to say that agriculture is consistently ranked as one of the most dangerous industries in which to work. The morbidity and mortality rates are high due to a number of exposures, such as machinery, large animals, and chemicals. Pesticide use poses a significant threat to workers worldwide. For children, the risks of all of these exposures are magnified due to the fact that they are physically and cognitively, developmentally less than our adults. There also is the potential for children to be exploited by supervisors and other workers within the organization of work. Regulations on child labor in agriculture vary from country to country. In the US, children of any age can work on their parents' farm, and children as young as 10 can be employed as hired agricultural laborers. This is significantly different from any other industry in the US, where children must be much older to work, and we refer to this as agricultural exceptionalism. Hired child agricultural workers in the US are overwhelmingly minority, and they are largely either Latino immigrants themselves or the children of Latino immigrants. Pesticide regulations vary from country to country, including how children are considered. In the US, pesticide registration is governed by FIFRA, which is the Federal Insecticide, Fungicide, and Rodenticide Act. The FIFRA registration process in the US emphasizes, quote, increased susceptibility of infants and children or other sensitive subpopulations from exposure to the pesticide, unquote. Also now within FIFRA is the worker protection standard. It specifies administrative safety controls, largely worker education, and the use of PPE for agricultural pesticide safety. The most recent revision of this in 2015 specifies that children under 18 may not be pesticide handlers, or they may not be early entry workers. The actual uses of pesticides in agriculture and the potential of child worker exposure depend on the registration process and the enforcement of pesticide and labor regulations. Enforcement should be guided by the hierarchy of controls. Elimination and substitution of pesticides are the best, and they have been attempted in certain circumstances. For example, in the US, most organophosphorus pesticides have been eliminated from non-agricultural use, and several, such as chlorpyrifos, from agricultural use. Yet the most widely used approaches to protecting workers from pesticides are administrative controls, such as safety training and using personal protective equipment, both of which place the onus on the worker. I'm going to turn it over now to Tom, and he's going to start talking about question 1.
So if I first slide, thank you. Good morning, this is Tom Archery, and I do want to note that the reason that Dr. Quant and I are not wearing masks and are sitting this close to, still sitting this close together is because we're married. So we're in contact all the time. I'm not going to repeat everything that Sarah has just said in this short introduction to question 1, but I do want to emphasize some points. First, child labor continues to be a concern around the world. ILO and UNICEF estimate that 70% of the 160 million child workers worldwide work in agriculture, with 3/4 of child labor occurring in rural areas. The largest part of child labor occurs within families. Rules and customs concerning child labor, whether they're formal regulations and their enforcement, as well as local informal standards, are quite variable within regions, across countries, within countries, as well as across industries. Slide 2, please. So, for example, within the US, federal regulations on child labor in agriculture are quite limited. Children employed by their parent, or quote, a person standing in place of a parent, unquote, whatever that means, are exempt from any child labor regulations, including those related to the US EPA's Worker Protection Standard for Pesticide Safety, which is part of FIFRA. Next slide, please. For children employed by non-parents, hired agricultural workers, regulations are age dependent such that those under 10 should not be working in agriculture. Children aged 14 and under can be employed outside of school hours in non-hazardous jobs with parental permission. Once you hit 14, you can do that without parental permission, and then children 16 and 17 can work in any job on farms in unlimited hours. Next slide, please. In addition, since 2015, children under 18 cannot be pesticide handlers or early entry workers. A few states, California, Washington, Florida, have more stringent rules on work with pesticides. However, research by Human Rights Watch and others document that children under age 10 are engaged in agricultural work. Our own research with child farm workers in North Carolina indicates that other than the under age 10 rule, no one is aware of the regulations on parental permission, non-hazardous jobs, or school hours. And one final note here, reflecting a somewhat American hypocrisy, the United States Department of Labor has implemented programs to reduce child labor in other nations and publishes reports on the worst forms of child labor by nation. However, it refuses to discuss child labor in US agriculture. It simply states that its regulations for minimum ages for work have exceptions for agriculture. And I'll stop there. We can start our discussion.
So thank you, Tom and Sarah. I think you've covered so many issues in a very short, succinct way and raised many questions. I know myself, I've already been thinking about many things that you've raised, and you're talking about the US context. So we invite everyone now to go to the chat and give examples of child labor in your country, or the country you work in, or if you're from the US, I see some people from the US, the state perhaps that you work in, and who's responsible for child labor regulations and enforcing these. Perhaps you can also list any barriers that you see to enforcement. So we'll chat for a bit and then we will post some poll questions as well, and we'll guide you on how to do that. Tom and Sarah, I invite you, if you want to keep your video on, you're welcome to, but I invite you to keep your microphone on. And if you, I'm assuming you can see the chat and you can just verbally respond to things as they come up.
We'll try. Our past experiences, they come fast and furiously.
Yes.
So be sure to pick out ones that you think we should particularly comment upon.
We will do that, yes. And people are also welcome to make any comments if you want to make a comment or ask any questions from what you've just heard. See you all in the chat.
US. Yeah, so someone just noted that in South Africa, there's a lack of data. I would argue that there's a lack of data everywhere. In fact, I'm going to talk about that under question 2 a little bit more expansively, but no one really collects data on pesticide exposure systematically across agricultural worker populations, children or otherwise.
So if you'd like to respond to the poll, you'll see that there's a menti.com link in the chat, and all you need to do is click on that. And thank you, someone from Germany has already posted, and do continue to include your country, that helps. Thank you.
And I see people are talking here in South Africa. that the Department of Employment and Labor is responsible for enforcing the basic conditions of employment, which categorically prohibits child labor. And I think it would be interesting to know how successful they are in actually doing that work. And I saw another person talking about mostly children are assisting in family-owned farms. And again, that's in South Africa. You know, I think we have agencies responsible for enforcement. And the issue is, as I said in the introduction, if they actually do the enforcement.
Yeah, wage and hour is responsible for enforcing these. However, they have a limited number of inspectors and generally just respond to complaints. So unless a complaint is made, they tend not to enforce any of these regulations.
I'm interested in a comment from Iran that acknowledges that there is research that on the beneficial side of child work in agriculture in rural areas. And I think that is what we run up against in the United States as well. I did a radio interview with a farmer who was head of an agricultural group who talked about what a wonderful experience this was for children. And of course, his children were probably well protected, but we're talking about hired children, and I doubt that that is also always the case. I'm glad to see that in Iran, there also are things on the harmful consequences of working. I am interested in the comment from Jamaica, where child labor in agriculture is really not seen as part of child labor.
Yes.
And I think that is largely the same in the US. It's a cultural issue. Children on farms.
Right. You know, children working on their parents' farm, but again, very few children do work on their parents' farm in the United States because most agriculture in the United States is now highly commercial. The comments often made in this country are that work improves the character of these hired child farm workers. And it's always amazing to me that child farm workers who tend to be members of minority group need their characters improved when what they really need is better education and more opportunities.
Right. I'm interested in the comment from Uganda that says that child labor is a new concept. And I think that that is probably true in many countries. In the early 1900s, that became a new concept in the United States after some disastrous events in factories and so on. But somehow agriculture was left out of that.
It wasn't somehow, it was a systematic process of leaving agriculture out to protect Southern growers and their sharecroppers.
Right. Well, that's particular to the US.
Mm-hmm.
Okay. Right. So in Zimbabwe, subsistence farming and the participation of children is considered part of their training, and that's not considered child labor. And the children are not paid, yes. And so I think the research we're doing in the US is specifically on children who are paid. Yeah.
And who probably will not continue as farm laborers when they become adults. So we work with organizations to ensure that these children complete their education and move on to other industries.
Right.
Before we move on to the other poll, I don't know if you want to make any comments on what you're seeing in the poll.
Oh, well, I should look at the poll.
There's lots.
We're not seeing a lot in the poll. I'm sorry, I had expanded the chat on my screen. Okay. So there's some sharp contrast here between, for example, Germany, where child labor is prohibited and compulsory schooling is enforced. And then Eswatini, for example, where there are no regulations on child labor. Well, here someone says they do have a regulation on child labor. Okay. And I'm glad to see some of you say that there are regulations, but they're not effective. I suggest they're not effective in the US either.
Not in agriculture. In other industries, they're much more effective.
Right.
When my daughter was 16 and wanted to do a summer internship in a lab in my medical center, she had to get a work permit, which meant going to the Department of Social Services and filling out a number of forms. However, if she wanted to go and work in agriculture at the same time, there would be no such need to fill out forms.
Yeah. Okay, so I see, Andrea, you have the other poll up.
Yes, correct. We've posted it and we encourage people to click on the responses by clicking on the Menti link in the chat. And I can see some people are already responding, so thanks.
I'll be surprised if we get any responses in the second that the family farms are more strict.
Yes, and in South Africa, we do have children who spray pesticides on their family farms.
Right. Well, we have interviewed the parents of on family farms who have children working, and the literature supports this, who state that they don't want any regulations because it's their children and they know what's good for their children, and they don't need any government regulation on how they monitor the safety of their children. And yet when we interviewed their children say, oh, our parents ignore the safety requirements all the time. So,
and there are a lot of injuries to those children. I mean, the estimate is that a child dies on a farm in the US every 3 days. Now, that's not all children who are working. It might be children who are visiting, but still, it's an incredible mortality rate. But as Andrea says, for South Africa, data are lacking. Data are lacking here because it's not always included in the death certificate.
Right. And it's not even clear how many child agricultural workers there are in this country.
Right.
So there is a question for you from Jennifer Sass from the NRDC. I don't know if you'd like me to read it for you.
I see it. Is it true, she says, that most of the pesticide mixing and application by underage family members is done by sons, not daughters? This was the case 10 years ago when the Ag Health Study was looking at it. I don't know the answer to that.
The most recent research that I've seen was a survey that Steve McCurdy did on farms in California. And that's probably 5 to 8 years old now, maybe a little older than that. And that was still true in McCurdy's survey. But I'm not sure that there has been any research, primary research done since McCurdy's.
Yeah. And Andrea says she has a photograph of a 12-year-old girl applying pesticides with no PPE.
Yes.
Yes, I am quite sure. The son-daughter pesticide exposure issue is important. Yes. Which dilutes the risk. Yes, if you measure both.
Yeah, you have to control for gender when you're looking at these issues.
Right.
But I will say for our research in North Carolina, about a third of the child farm workers, they were children 10 to 17, who we interviewed were girls.
Right. But of course, the data that Jennifer Sass is talking about is coming from applicators, so largely farm owners.
Right.
So they're talking about their children. So these are children working on their parents' farms. And, you know, tasks in agricultural households have always been very gendered in the US.
Yes.
So what I'm taking away from a lot of your responses is that many countries have regulations. Some don't, but you know, there are a lot who do. But it is in fact the enforcement that is probably the issue. Someone notes that children are exposed while handling livestock. Yes. And one of the comments made was, well, children are doing household tasks, so there's no pesticides used there. However, cleaning agents have pesticides often, or what would be classified as pesticides. And so I think we can't assume that just because children on farms are not directly working with crops or with animals, they're not exposed to pesticides. And there also are environmental pesticides.
Plus, you know, one has to, all the research that I have seen and all the research we have done shows that the homes of agricultural workers, whether they are farmers or farm workers, have high levels of pesticide, that there are many pathways of pesticide exposure in households. And just assuming because a child is not directly involved in farm work, if they live on a farm where pesticides are used, there is exposure. And
yeah. Okay, so the comment by Andrea in South Africa, assumption that women mix and men apply, so women are not given PPE. Perhaps that is an issue for children as well. Yeah, I don't know. I will say in the US, typically children are not mixing and applying. Though, as we said, by the time they get to be 16,
right. Well, the issue
they can
of
do that.
mixing in particular, when you talk to farmers, is they say, we don't let our workers mix pesticides. They're too expensive. We do that ourselves, but the application, the handling of it can be done by anyone. If you can put a backpack sprayer on a child, which you can, they can apply pesticides. So there is this differentiation in terms of mixing, again, just because of the cost of the chemicals.
Frederick in Kenya asks, how can you treat indoor residential spraying of pesticides by children? Can this qualify as child labor? To me, what we're talking about is hired child labor. And so if children are being paid, yes. But of course, if they are doing it routinely as, you know, children within their own household, I think this is a gray area.
Yes.
Our own country doesn't seem to want to call that child labor. And several of you have noted that working on one's own farm and therefore in one's own household is not considered child labor in your country. So I guess we're coming sort of to the end of the time on the first one. And it's interesting to look at the poll here that 4 of you don't know in your country about whether there are different regulations. But the largest responses are that the regulations are the same for both hired and working on family farms. And then a few of you, if I had responded, it would have been yes, family farms regulations are less strict than non-family farms.
I think that raises an important point. You know, even when Tom was speaking about, you know, that children from the age of 16 up can work with hazardous substances or do hazardous work in agriculture. And if you look at, you know, this difference between the family farm and sort of paid work, you have to think about the children's vulnerability and the fact that, you know, they're still children, they're still developing, they still have the same vulnerable issues and circumstances in relation to their development. So it's quite interesting that.
Right.
So I think we can move on to question 2. Thank you very much for taking us through to question 1, and I hand over to you.
Thank you very much. So I'll again be introducing question 2. So as we've said, children are more susceptible to illness and injury from pesticide exposure than are adults. This needs to be taken into account in regulating their pesticide exposure in agriculture. So children have greater surface area relative to body volume, so they can absorb relatively greater amounts of pesticides than adults. Their metabolic systems are not developed. They're less mature, so their bodies are unable to toxify some chemicals, such as the organophosphate pesticides commonly used in agriculture. Behaviorally, children may come into contact with pesticides through different routes than exposure, including hand-to-mouth activity in very young children, and working, studying, and playing in contaminated environments. As we say, most housing in which agricultural workers live is contaminated with pesticides through take-home exposure. Compared to adults, children are particularly susceptible to pesticide exposure on the developing neurological system. Now, much of this development of the neurological system occurs prenatally and in early childhood, but brain development continues throughout childhood and adolescence, resulting in functional and behavioral alterations. Next slide, please. Reported pesticide exposure among child agricultural workers and among the children of agricultural workers is still a major concern. However, limited research has actually measured pesticide exposure in this population. No regulatory approach to consistent child agricultural worker pesticide exposure assessment has been implemented. The limited evidence indicates that child agricultural workers are exposed to multiple pesticides, particularly organophosphates and pyrethroids, with high levels of exposure to these two classes of pesticides. It is important to note that child agricultural workers are generally exposed to several different pesticides simultaneously. For example, our research with child farm workers in North Carolina found that individual children had detections up to 22 different specific pesticides from up to 7 different pesticide classes. Specific pesticides and level of exposure differ by location. I'm talking regionally now. For example, comparing recent assessments of personal pesticide exposure among Latinx adolescents in California on the Pacific coast and North Carolina on the Atlantic coast found that both populations had similar detections for most pyrethroids. For example, 50% in both populations had detections for permethrin. They had different levels of detections for organochlorines. 55% of the children in California had a detection for DEE, compared to 4% in North Carolina, whereas in 30% of the North Carolina adolescents had a detection for alpha-chlordane, compared to 12% in California. About 35% in both populations had detections for chlorpyrifos. Now, I'm not a toxicologist, but I read this literature a lot. And when we talk about measuring pesticide exposure, I think there are 3 limitations constraining measurement of actual pesticide exposure. The first is cost. Laboratory procedures are very expensive. In our research, we paid between $250 to $500 per sample for analysis, laboratory analysis. The second limitation is logistics, getting samples from the field to laboratories. And the third limitation is available laboratory procedures. Procedures are available to measure some, but not all pesticides or pesticide metabolites in different matrices. These lead to the overarching scientific conundrum that researchers can only find the pesticides they look for, and they only look for the pesticides they can measure. For example, if you can measure TCPY in urine, you look for chlorpyrifos, but you might not look for exposure to other OPs or other insecticides. If you can measure DAPs, dialkyl metabolites in urine, then you look for DAPs, but you will not be able to measure exposure to acephate because it is a non-DAP organophosphate. So now with that, we can move on to the questions.
Thank you for that. You raise again some important points, and I hope people will pick up on those. So question 2 is asking you to think about, again, in your country or the country that you work in, what are current regulations regarding children working in agriculture where they might be exposed to pesticides, and who sets these regulations specifically now looking in terms of pesticide exposure, and how can these regulations be strengthened to protect children? While you reflect on that, please do put your thoughts and answers or questions, any questions you might have had that Tom raised in the chat, and we will have some poll questions as well. Thank you.
As you're starting to write, I'll just note a comment made from one of you in Jamaica that from our previous question, that it's really important to get pesticide into death certificates, and I guess someone else raised this, so that somehow it's also part of the medical history, so we can look at diagnosis and cause of death. And I think that is an ongoing issue in the US, trying to get an environmental history taken when a patient comes in, or a work history too.
I'm turning.
Okay, I'm looking at the one from Zimbabwe, and it could have been written in the US. Children always welcome parents coming back from the fields, whether they've handled pesticides or not. And that's part of the education we try to do with workers about changing clothes outside, about showering or washing before they touch children. And it's actually in the worker protection standards. So that is, workers are required to be taught that. But you know, enforcement of that is a little hard to do.
And I'd like to make a statement about training here. We do pesticide safety training. We develop pesticide training materials, but you can't train your way out of pesticide exposure. You have to think about changing how work is done and what pesticides are used, because if the pesticides are endemic to the environment in an agricultural community, whether in homes or fields, training is not going to do you solve the entire problem. So. Yes.
So there's a poll question again. Do regulations in your country require reporting of child pesticide exposures? And you can click on the link in the chat to respond. Thanks.
I think, again, there's a comment from Iran and talks about babies on the backs of mothers working in rice fields sprayed with pesticides. And that brings up a larger structural issue, which is lack of childcare. We see that in the US as we have children picking blueberries along with parents because they don't necessarily have a place, a safe place for their children to be while they're at work, and they perceive that as being safe.
Yes, and although there is a system of what we call migrant Head Start in the US that takes care of the children of migrant farm workers, only 40% of farm workers in the United States are migrants. So the seasonal, those who don't move around, have a harder time getting this kind of childcare.
Right. I think we're moving a little bit away from child workers, but I think it's valid to talk about children being exposed in many contexts
Well,
on farms.
yes. I want to look at the poll responses.
Okay.
Yes. Pesticides used in suicides is a particularly important issue. It is organophosphates in the United States are the leading cause of poisoning suicides.
Right.
Vehicle.
Right.
So the other part of all of this is training our healthcare providers to recognize pesticide exposure if we're going to make it a reportable event. In many cases, healthcare providers aren't trained in occupational health at all, and they're definitely not trained in understanding pesticide exposure and how to deal with it.
There was a question to better explain in this question, pesticide exposure, do we really mean pesticide poisoning? And I think, yes, we do.
Well, I disagree. So pesticide exposure covers a number of issues. So if we have low-level pesticide exposure, chronic low-level, which is mostly what happens, you do have long-term health consequences from this. That's what the ag health study has shown. And we can differentiate that from acute pesticide intoxication, which we would normally call pesticide poisoning. Both of those things are bad.
Well, they're bad, but the regulations in your country require reporting of these, and they don't require reporting of the low-level exposures.
Yeah.
And part of that is because they're pretty non-specific in their symptoms or their lack of symptoms. Okay, I'll close this down again. Right, I see someone who says no, but occupational incidents should be reported if they result in ill health. Well, part of that is the worker has to report it.
Yes.
What we find is that it's difficult, at least in the US, and I suspect elsewhere, for workers to report this. In our country, they would have to report it to the grower, and the grower would then have to take them for medical care. And it's at that point that a report would be made. It can't be made just by an individual worker.
Plus, the individual worker, if they don't work, they don't get paid. They don't get paid sick leave. So if someone experiences some low-level symptoms of pesticide exposure, they throw up and they don't feel well. Oftentimes, and I've talked to some workers, they'll stay home for a day, but they don't want to lose any more work time than that.
Right, and someone from Germany has noted that, yes, it is reportable there. However, what we have found is that not all physicians are trained well enough or have access to the laboratory tests to determine that something is a poisoning. And so in our country, in tobacco harvesters, it may simply be green tobacco sickness or nicotine poisoning. It could be heat. Many of these have quite similar symptoms. Clearly, when you get to the point of being in a coma, that is not the same. But
do you want to make any comments on the poll before we move on to the next one?
So this is the first one. Yeah, I'm kind of reading. I'm reading the comments here. Right. I guess overall, It looks like, yes, there are regulations that require reporting.
But the question always is how good is the reporting? And there are a lot of issues that can limit the quality of the reporting.
Right. Yeah, I think what it says is that the responsibility for protecting children from pesticides rests in a number of different places. And part of it rests in the medical system of diagnosing those. And I know, Andrea, you've talked about how this is not agriculture, but in urban pesticide exposures, it is so common that the children are simply given antidotes and sent home and not even registered.
Yes, that's very much the case for rat poisoning, rat poisons, where they come in with blue urine. They get vitamin K and are sent home.
Right. What often happens in the US, and I suspect it is elsewhere as well, is that there is a cluster of poisonings. So that a group of people may be sprayed at one time, and that tends to be reported more so, I think, than individual workers being exposed.
So we have moved on to the next poll. If you'd like to vote on it, just click on the link in the chat. It'll take you straight to Menti. Does your country have specific pesticide regulations for child agriculture workers that differ from pesticide regulations that apply to adults? Thanks.
These questions made a lot of sense when we wrote them a couple months ago, but now when I'm looking at this, does your country have specific pesticide regulations for child workers that differ from adults?
Well, the US does, but
yeah.
The question is, the enforcement of that is limited.
Right. And when I just look at that question and think about it, I always think about amount. We know that adult workers are getting low-level exposure all the time, but what's really the pesticide regulation is on poisoning. It obviously takes less to poison a child than it does to poison an adult. So the regulations are on which pesticides may be used, but there's nothing about amounts.
Right. Well, it's not just what used. Again, children, no one under 18 should be mixing or handling pesticides in the US, except if your parent owns the farm.
Yeah, but
then,
hired,
yeah.
No one should be doing that.
So, but there's nothing in terms of regulations of, and you're not supposed to re-enter during the no re-entry period, but there's no regulation on ongoing exposure and no monitoring of ongoing exposure from just exposure to residues that are in the fields.
Yeah. I'm looking at a comment from Sierra Leone that says lab staffs are not trained to look for chemicals and pesticides, and certainly access to laboratories is necessary to detect it. I'm wondering, out of all of this and looking at all of your comments, if there is kind of a hierarchy of action here, in that we're talking about the exposure of child workers. And so, you know, the first thing may be to have children not be employed in agriculture. That would be, you know, probably the best control. The next best would be to have them restricted in what they could do or where they could be when pesticides are being applied.
Or when consider the reentry interval and maybe extend it for children, because that would reduce it. I think one of the things when we're looking at research on pesticide exposure, in my reading of this research, there seems to be 4 approaches to assessing whether a child or children or anyone is exposed to pesticides. The first is an assumed exposure. This is people do an ecological assessment. That is to say, children living in cities and compare those to children living in rural areas or on farms. And it's assumed that the rural kids living on farms have more exposure, and then we look at outcomes. What we have found in our research is that Latino kids living in cities, and other people's research too, by the way, often have almost as much exposure as children living on farms. Then people can do an environmental pesticide assessment, that is doing wipe samples, dust samples where people live, on the tools that they use. Then there's a personal assessment, exposure assessment, which is what we've done on our child, which is using a passive dosimeter, which is a silicone wristband to measure exposure. And then finally, there's biomonitoring. And each of these approaches have different problems and different benefits. So we have to think about, if we were to assess child pesticide exposure, how we would do it. I'm working with a group now that's trying to come up with a quick way to do cholinesterase depression, measure cholinesterase depression using blood samples, finger stick blood samples. But the problem with that is that cholinesterase is really just, depression is just an issue with OPs, organophosphate, and carbamate insecticides. It doesn't assess pyrethroids or the neonics.
Yeah. Right. And I think our data from the US, and I suspect from elsewhere, with these child laborers, indicates that their exposure can be in a number of places. It can be in the fields, it can be in the home, it can be just in the schools. And that gets in the way of trying to establish regulations, because it's impossible to tell where the exposure occurs. And so then you get, in our country, you get the agricultural establishment who argue against the need for such regulations for child laborers. So I see, Andrea, you've posted another question here. What other regulations do we think should include specific reference to child exposure?
Just move on to the next thing.
Yeah. Right, I'd be interested in the answer to Andrea's question. What other regulations should include specific reference to children's exposure to pesticides? I mean, I think there can be requirements put into medical assessments. I mean, certainly, or at least medical standards. At least in some countries, there are certain kinds of medical exams or treatments that children must receive before they go to school or they advance in school. And that's a place where some of this assessment could take place.
The problem with pesticides is they, at this point, are across our environments. And unless we reduce the use of pesticides, it's going to be very difficult to reduce exposure. And I will bring up the example of organochlorines. So organochlorines were pretty much banned from the United States for decades. Yet when we've just measured exposure using the silicone wristband, we find a majority of the children tested have exposure to one or more organochlorines. They're going to be there for a long time. Similarly, the OPs, although they are non-persistent in enclosed environments, they, like houses, and barns, they also stay there for a long time.
Right.
Yes.
Right, someone notices that enforcement, yes, I mean, there are regulations that exist. The problem we see is they're not enforced, and many of you have said the same. Andrea, you noted that maximum residue limits in foods that children specifically consume are not in place. Yeah, I will say with the licensing of pesticides or the registration of pesticides in the US, there's much more care taken with what ends up in the food system, food supply, than what ends up in the workers. But again, you know, trying to figure out exactly foods that children specifically consume. In processed baby foods in the US.
Anna, you know the.
Someone needs to mute, please. There are a lot of regulations that are in processed baby foods. There is much less use of baby foods now than there used to be. People make their own out of adult foods. Fumigation services in schools, yes, that certainly is a pathway for exposure. In schools and hospitals, in all government buildings, there's a lot of use of that.
So I don't know if you want to comment anything further on the poll, otherwise we can move on to the final question.
Let me pull those down so I can see it. Well, there's an overwhelming response, isn't there? The pesticide regulations are the same for children and for adults. And in some ways, that ignores the fact that children are not little adults. And that's a very important issue in terms of the outcome, measurement of health outcomes and educational outcomes and so on for children. So
Great.
I guess, yeah, should we move on?
Yeah. Unless you want to comment on anything else that's coming up in the chat, but yeah.
Well, at this point, I can't look at the chat and look at the screen at the same time. So, all right, here we go. So we're going to move on now to question 3. And in some ways I tack this on because this is what I do a lot of, is developing health education materials. But also it's the fact that, you know, we have here again the hierarchy of control. And we know that keeping children out of contact with pesticides by either eliminating the pesticide or substituting something less harmful or engineering controls, all of those would be very effective. But the point is, right now, that's not happening. And so I think that we have to look at the fact that parents and children need to be educated about pesticide risk, that this is valuable. Could I have the next slide, please? But unlike educating professionals with advanced degrees about pesticides, people like who are on this call, methods for laypersons have to consider a number of factors like their literacy, formal education experience, and access to technology. There's several reasons, I think, to educate children and their parents. And the first one is simply knowledge about occupational health and safety. Many people have not had training, and they need to know what the risks are. The second reason is that you know, we can improve the safety and health skills of parents and children, so they know what to do to prevent exposure, to report exposure, and so on. And the last one I think is really important here, and that is we can increase the self-efficacy of putting these skills into practice. And self-efficacy means having the confidence to actually use these skills, to know how and be willing to put on PPE, to, in the US, to be willing to say to your supervisor, no, I will not go into that field because it's posted. So it's the belief that you can do that. Next slide, please. So there are a number of characteristics when we're thinking about training materials for parents or children, several things that need to be considered for them to be effective. The first thing is they need to be evidence-based. We've looked at some in the US that are not based on research, or they're based on very old research. And so we need to train people in ways that we know are effective. They also need to be culturally appropriate. Throughout this chat today, people have talked about family farming and the values associated with that, and how it helps child development. So somehow any training about pesticide safety has to acknowledge that parents and maybe even children have these kinds of values. And it also has to be consistent with their life work experiences. Parents have probably had very risky work experience with regard to pesticides, and so we need to train them that that is not appropriate. And obviously things have to be linguistically appropriate, in the right language, vocabulary, and idiom. Next slide, please. When we go beyond simply training materials, and there I was talking about things like videos and so on, and talk about entire programs of training, we know that they need to be educationally appropriate, the right literacy level for adults. We know that they bring work and life experiences as well as problem-solving skills, and we need to take that into account. We know that their motivations for learning differ, and so on. Also, the training programs have to be realistic and fit the available resources. I've given a couple of references here that talk a little bit more about that, one from the ILO, one from our work, and they need to be realistic in terms of the possibilities for actions that are found in the work environment. Next slide, please. And in particular, when we're talking about educating parents, they have to be treated as adults. Using hands-on activities, we have done mapping, I know with Andrea, and perhaps with some of you in South Africa. We've used that here, role-playing, risk, theater, video, photo voice, things like that, and storytelling. Often these are the kinds of activities rather than strict didactic kinds of types of education. And so for this, what we're interested in, if we can go to the next slide, I guess it will list the question. In your country or the country where you work, are there efforts to educate employers of children, parents, or children themselves about the dangers of pesticides? And how might that education be best conducted to protect those children? So I'll be interested to hear your responses to that.
Thanks, Sarah. We'll move into the chat and then we'll shortly have some more poll questions.
I find it hard to believe that anybody can educate themselves by reading labels. Maybe things different are from the United States, where the rule is the label is the law. So the label can be pages and pages and pages long of technical information, and trying to figure out what one would do to keep one's children safe is hard to find, and is often written in language that is only comprehensible to someone with a master's degree in toxicology.
But I'm interested in the one from, I guess it's from Zimbabwe. Dangers of pesticides to children are taught through farmer clubs, which I suspect is similar to some of the or things that we have in cooperative extension in this country.
4-H.
Yes, but that, you know, and I think that gets to parents of children who are farmers. But when children are hired as agricultural workers, their parents may not necessarily be in such organizations because they may not be farmers. And this is in Malawi, a lot of zeal by government agencies and NGOs to educate all stakeholders. Right. And it's quite necessary. I think efforts to incorporate pesticide issues in the school curriculum to get at children early is very valuable.
Yes, I think in rural communities in particular, but also in urban communities, including information in science classes and in health classes on pesticides would be very valuable.
Yeah.
Yes, in Zimbabwe, there are programs, but remains the financial limitation. And I think that's true in many places. And so taking the ag extension resources and combining with the local education resources might be a way to go here.
Right. Right. Yeah, and Andrea brings up the recent FAO forum on child labor, creating a safe working environment for all. Yes. Right. And someone mentioned the use of media. And I think now, particularly, social media is being used, and then broadcast media as well. And those are good places to have this happen. Somebody said it's best to educate children. I will say that, you know, there are examples from around the world where educating children and then the children tell their parents what to do. Occasionally that has worked with things. I'm not sure how much that will happen with pesticides, and one hates to put the burden of protecting yourself on small children. But I do agree that we should be educating everyone. And somebody from Zimbabwe notes that educational programs like this require resources. They do. I think the ILO module that I put in the original outline for this is trying to get around some of that so people can easily adapt materials to be used. Lay health promoters have been used for pesticide education, and they appear to be quite successful at that, but they see a limited number of families, of course. Again, Dominican Republic, putting it in schools. Yeah.
Yes, but educating child workers when child labor is illegal you have to go through something other than the workplace. So the schools would be a place to go.
Right.
On the other hand, we have, I understand that educational systems vary from country to country, and the accessibility of everyone to educational systems, particularly in rural communities, can be different when parents may lack the fees necessary to send their children to school.
Right. I mean, if children are working to earn money, then they're not in school often. Right. Right. Again, Kenya. Now the possibility of doing it through agricultural clubs in the schools.
4K.
Right. Yeah, we call it 4-H in this country. You have 4K. But one of the things that has to happen is then teachers have to be educated in order to do this. And there are a lot of misconceptions out there about pesticides. And there is a lot of old knowledge about them.
The other issue, and I'll bring this up from the current situation in the United States, is first, we're asking teachers to do more and more and cover many different issues, plus the politics around pesticide safety have to be taken into consideration. So actually talking about pesticides may be harmful can cause pushback from the large agricultural industries in our countries, and not want public schools or any schools to talk about pesticides as maybe being a health problem.
Let alone pesticides can kill you.
Yes.
And being that clear about it. Yeah, and I think there is probably economic pressure worldwide from these multinationals that are peddling pesticides. And so at some level, that gets in the way of education.
Yeah.
As someone here is saying, in Nigeria, it's the NGOs that are mostly conducting pesticide education.
It would be great if we could convince the large pesticide companies to support safety education. Unfortunately, as I've seen issues of large international tobacco companies in the United States trying to eliminate child labor, that often ends up this being a PR front for the tobacco companies.
I like the comment from Nigeria, but I guess I disagree with it a little bit. And I'd be interested in your take on this. You say, I believe incorporating pesticide exposure into school syllabi will educate children and this will require no extra cost. Unfortunately, I think all educational initiatives require some extra cost in terms of developing materials or adapting materials. And training the trainers. So there is always some cost. I think by our sharing materials and keeping them simple, it may be possible to lower the costs. And I certainly agree with the comment that ultimately countries need to stop looking at pesticides as the only way to achieve food security. Yeah. Yeah. I know Andrea queried Obama about the programs run by CropLife. And you say you have huge training and education programs. Perhaps you could sort of say who's getting trained there, and if any of this is aimed at child safety, child workers, or children in general.
So we have our last poll on the screen, list examples of efforts being used for pesticide education of workers. So we are sort of talking about this, and if you want to give more specific details in the poll, you're welcome to do so. You can click on the link that's in the chat.
Yeah, I'm particularly interested in specifics about education, like what are the media that are being used, and what is the message? Is it as harsh as perhaps it should be in thinking about the effects on child's health, on their future health and development? That's one of the problems we have in the US, because the pesticide companies see it kind of as not well established that exposing children at an early age may affect their later development. Right. And I see Obama notes that in the CropLife programs, they do have a component on avoiding children exposure to pesticides. Part of what we've seen, at least in the US, is people don't really understand the multiplicity of ways that children can be exposed. Yeah. Yeah, I see in Zimbabwe in the cotton sector, some train the trainers. That has been a method that we have used in the US. We certainly have found that women training other women in household exposure has been popular. It has been successful in training and changing knowledge and some practices. The evaluation of that is always tough. To see what you are actually doing with it. Right, and then the comment here back to me that, no, it's not cheap. It's not free to do teaching materials, but it's cheaper than the ultimate cost of doing nothing or delaying. Absolutely, you are correct. However, different people pay those costs. And so if you do nothing or you delay, it's children who pay the costs and families. Whereas if you do the teaching materials, it's largely the government that has to pay that price. So I do agree with you that incorporating into the school syllabus should get you a large audience. And someone posted that of not being aware of such large efforts in Zimbabwe. I think one of the issue is we find in the US that different people don't know what's going on. I don't doubt that there is no large scale effort, but it sometimes is hard to know what's going on. Yeah, and here's somebody talking about in Jamaica, Poison Information Network doing things in schools. And I certainly think in the US they do that. I'm not sure how much really gets specific to agriculture. Yeah.
At least in the US, the part of the population that's engaged in agriculture continues to shrink. So it's harder and harder to get agricultural specific information into the curriculum. That's why pesticides in general should be included in the science curriculum.
Yeah. Right.
And I think one of the other issues is that we can't have a program that starts with lots of fanfare and then over a couple of years it's just loses the intensity needed to keep it going and the funding to keep it going. As I've seen in when other issues arise, particularly I'm familiar with children working in agriculture and tobacco production in the US, there's a lot of news media attention, and then there's companies saying, oh, we're going to address this, and then after a year or so, nobody thinks about it anymore and they go back to the old ways.
Right. I see Andreas put a wrap up in here, but I do want to say with Frederick from Kenya, who mentioned the use of animation, that yes, this has been the way that we have taught both adults and children. And now that you've got social media and you can put messages on that, I think it is effective. But as you mentioned, Frederick, it comes at a cost. Every time we've developed a video, even though we use limited animation, it takes a big chunk out of the budget. So, right. Somebody notes that all pesticides label bear a pictogram, keep out of the reach of children. And I think that's absolutely true, but you know what that's aimed at? It's aimed at children consuming or dipping their hands and absorbing pesticides through the skin. And it's really not aimed at a lot of the exposure that goes on. And we know, at least from research in the US and elsewhere, that children who are simply in an agricultural environment by the time they're 7 years old, their IQ is lower. The more pesticides they've been exposed to prenatally and early in life, their IQ is lower than children who've not had that exposure. So that kind of pictogram doesn't put it on parents' radar.
As I've always said, when we do pesticide safety training, people just have to be sure that they understand and that everyone understands that, in fact, pesticides are poison and you should really wash your hands.
Yeah, among other, yes. Okay. Andrea noting, yes, we have pictograms and people can't necessarily interpret them because, yes, they're based on, you know, your previous life experiences with this kind of condensing of information. And so I think we need to really do evaluations of some of these methods of
Well, someone just said funding is always going to be an issue. And I will, again, put this forward, that the large pesticide companies, several of which are located in North Carolina, as well as CropLife, which is an international organization, but particularly the corporations seem to be highly profitable. And perhaps, as there is in North Carolina, a small tax on pesticide sales, that could be implemented to fund these educational programs in the schools and in the communities. So in North Carolina, it's the Pesticide Environmental Trust Fund.
right. So, you know, funding is going to be a big issue, but that doesn't mean there's not money out there. And we know where the money is. The money is in the profits that these companies are making. And probably, I've talked here about education of parents and children as, in some ways, a stopgap, or at least complementary to trying to, as one of you has already said, finding other ways of promoting food security than just pesticides. You know, if we're going to have regulations, and we might need regulations about education even, that takes education of our legislators and the people who write the regulations. And so it's not simply education at this level. Through the entire, you know, I guess, hierarchy, we need to have education specific to children and specific to child labor in the countries where it exists.
Radio campaign in Nigeria.
Yeah. Did we do our last poll question? Or our other one?
Yes, we did. I think this was the last one, if I remember correctly.
Okay.
I must have missed the other
Can
one.
you see it?
Yes.
Yes. This is
I'm
the
just
open-ended one.
Right, I missed
Yeah.
the closed-ended one. Sorry.
No problem. So we've got 2 minutes left, and before I do a closing, I wondered if there are any other statements that you would like to make, or any other points you would make. You've said so many things that have been fantastic. And just a reminder to our participants that there's an evaluation poll on the screen, and we ask that you please fill this in. It helps us with our work. So Sarah and Tom, any last comments before we close?
Well,
Child labor needs to be addressed.
Yeah.
It needs to be addressed by every country, including the United States, in agriculture. Pesticides are designed by definition to kill things, and the mechanisms they use to kill things can also affect people. So we have to take that into account when we're licensing pesticides and when we're training people to work around them.
I think there's variation from country to country, as we've seen here, and that some countries have and enforce stricter regulations about child labor. In many countries, there's always going to be a tension between the necessity, in quotes, of children working and contributing to families' income and resources. But I think we need to, as Tom said, be realistic with the fact that pesticides kill things, they kill people. And short of that, for children in particular, they affect their cognitive development and their future health. They have more years to live with the effects of pesticides that take a long time to develop. And we need to be educating legislators. We need to be educating parents and children in these topics.
Thank you. Thank you for those concluding points. And I see Sharika has just posted, of course, a very important question that is quite involved to respond, but basically asking, how do you get political will is always a problem in many countries, and many low and middle income countries. And how do you get the government officials to use money from industry in order to address some of these programs that we were talking about in education, etc. And I really think the bottom line is, you have to have it in regulations that the industry need to pay a levy, or there needs to be some sort of tax. But then you also need to make sure that that money goes into not the central treasury, but goes into a fund that the people who are doing the work can access it. So that's a very, very short answer for a very important question. Louisa has one. I'm going to go over time. Louisa has one more question. It could be part of for the protection of children in the pesticides regulation instead of do a specific legislation. Yeah, so children should be referred to in general, particularly in our country, in South Africa, children need to be referred to as well. So just to wrap up, I want to first of all say thank you very much to Tom and Sarah for the effort and the work that you've put in, and for sharing your thoughts and also your work that you've been doing for many years on the topic of pesticides as well as with children. And I'm sure that you've left lots of food for thought for participants. But also, I think it's really important for participants to take away what they've learned today and see what little bit can you do, and hopefully some ideas were stimulated. So thank you again.
You're welcome.
And thanks. And thank you also to Tatum and Naomi in the background for doing the technical aspects. And if you're not registered for the University of Cape Town's Pesticide Discussion Forum, you will find the link in the chat. We do encourage you to sign up. The next discussion will be on gender and pesticides in a couple of weeks' time. And we also will be sending out a digest of this discussion for you to use, to circulate, to share with others, and perhaps to promote political will. So thank you again to all of you and to the participants for your responses. We appreciate that. And we hope to see you in the next discussion. Thank you, everyone. Stay safe and have a good rest of your day.